Hi, welcome to the section of cardiology. This is Dr. Jaitly. In this particular video section, I'm going to be talking to you about what are the benefits of yoga to the heart and to the rest of the body. We know yoga has been practiced for 5 millenniums. We know it originated in India, and then it spread to the rest of the world in the past several decades. Pretty much now it's in every gym. You can look around and in your gym down the block, or go to the other end of the town and visit a club. You will have instructions or lessons or teachers who are instructing their pupils on yoga. So it's a very, very fine technique of exercise practice, which has now percolated or spread to all strata of life. You visit parks, people are practicing yoga. You visit clubs or gyms, people are listening to soothing music and practicing yoga. Sometimes within the silence of their rooms, in their own homes, they are practicing yoga. Sometimes they are in the temples where people sit out and on the chanting of the mantras are practicing yoga. There are people who are sitting by the rivers on a sunrise or at sunset or by the sea. They are practicing yoga. So it has its own benefit, it has its own meaning to it, it has its own texture to it, which has really benefited the human beings in one way or the other. Now let's understand, yoga is not just a simple science where you can go and, get your heart rate up and sweat out and 30 minutes later leave and say, wow, what an exercise I did. No, that's not yoga. Yoga includes 2 major aspects of exercises. One, it strengthens the organs inside, and 2, it strengthens and beautifies you from outside. Now, how does it do all of that? Is by, again, 2 parts of yoga. One, the body positions that it seeks within the yoga practice, where the individual actually bends or transforms into a position which may mimic any flora or fauna on Earth. And there are scores and scores and millions of these species. So just to cite a few, like the lotus position, the palm tree position, the rainbow, the peacock, the crocodile, and so on and so forth. So these positions, if the person gets into even for several seconds to a minute, and it is very demanding, no question, because you're defying the gravity. But the fact is that the external as well as the internal organs benefit very, very immensely in these positions when the person gets into. Now, the second part, as I said, is the respiratory exercises, which are called pranayams. And they could be anywhere from breath holding to forced exhalations to hyperventilation or to rapid bellowing, etc. And they all have to be done rhythmically. So what have we learned so far? Yoga has an external and an internal benefit, which we'll delve into later on. Yoga is done in 2 parts. One, in positions which mimic the flora and fauna on Earth. And 2, the respiratory exercises, which are called pranayams. And just remember, the benefits are not accrued until after months and years of constant practice. Just like, you bring the money to the bank and an hour later walk back in and say, look, show me the interest. What is the banker going to tell you? Come back and see me a year later, right? So you got to keep the interest going for a while before you can actually accrue the benefits. So the whole idea is wanting to see that you want to accrue the benefits, but the benefits really happen after months and months and years of practicing yoga in these positions and in the respiratory exercises. We'll talk more in detail as to how it affects the heart, because that's where the subject is, and we'll be delving that into the next section very soon. Okay, stay tuned for more yoga. Bye.